Hi, everybody. My name is Rick from Ryse Recovery. If you're an active addict or an active alcoholic and you come home and my next guest is sitting on your couch with your entire family and your pets, I would run.
Hey everybody, my name is Joe Ortiz and I am a professional interventionist. I help families and individuals recover from addiction, and you can find me on the web at joeortizinterventionist.com, on Facebook, Joe Ortiz Interventionist, Instagram, Joe Ortiz Interventionist, and if you want to call me directly, you can reach me at 732-599-7817.
Well, can't you believe it's okay?
I was just doing the math. I've been in healthcare 36 years, man.
Wow.
I was a young man when I started, you know.
Okay, so...
I was like 21, 22.
So you've been in healthcare for 36 years.
Yeah.
And
How did
you start? How did you start out in healthcare?
I started off as a respiratory therapist back in 1990.
Really?
Yeah, I still have my licensed respiratory therapist.
What does that mean?
So he's the guy who intubates people and puts them on ventilators, manages them in critical care, emergency rooms. Those were my two favorite places to work, you know, if I was a young man saving the world, intubating everybody, you know. And so I did that in what's called the acute care setting for 10 years. And then I went into home care. And then I went into the business side of medicine.
Wow, so this has been like a lifelong passion for you, like, right?
I've always loved helping people, you know, so.
That's awesome. So, you know, Ryse is made up of several sober living homes, and our client is, you know, someone who goes from detox to rehab, and then we get on the phone with a counselor who's looking to a living situation, sober living particularly. Your client as an interventionist is a little different. So like, tell us a little bit about what happens when your phone rings.
Yeah, what I do happens way before they end up in a sober home.
Yeah. My job's easy.
So can I tell you how I got into it real quick?
Sure, of course.
So 5 years ago, I decided to come into this space of healthcare, right? Substance use disorder, mental health disorders. And the reason for that is I'm a man in long-term recovery like yourself for 11 years now. Yeah. And I just decided, I have a marketing background, and I heard of these positions, outreach coordinators and treatment advocates, and I decided I wanted to give that a go, and I did. And it's been a very interesting ride thus far, you know. It's been great, sometimes very challenging, as you know.
Sure.
You know, because this is something that's very personal to us, right?
Yeah.
But what I found was that where I found my success was in dealing directly with the families and helping the families, right? And speaking with them, and then speaking with the individual who needs the help, you know, and using what I had learned to that point to help talk that person into treatment, right? Help them understand that, hey man, you're not well, you're sick, you know, you're not seeing things clearly, and let's look at your history, you know, and look at where your family is right now, and they're really hurting, they're worried about you, that kind of thing, you know, the talks that we have. And so I started to have success that way in getting people into treatment, and therefore keeping my employers happy as well. And then about 4 years ago, this one person who's very well known in the industry, she asked me to help with a nephew, you know, and she said, would you do an intervention? I'm like, well, I've never really, you know, done a formal intervention, but let's do it, you know. And it worked out really well, you know. It worked out well, and I worked with the wife, taught her about boundaries and consequences, things of that nature, and helped to strengthen her, because he was really having his way with her, you know, in regards to just the house was chaos, you know. Anyway, long story short, he's sober 3 years now, three or 4 years now.
Wow.
And that's what inspired me to get formally trained as an interventionist.
You're like, wow, this is easy.
No. What it was very rewarding. You know,
I got it.
because you see the whole family change. You see the whole family recover, right?
Sure.
And not just the individual. And so that inspired me to go after getting trained and certified and mentored as an interventionist. And I did that during COVID. Part of it was during COVID. And launched my business, joeortizinterventionist.com. And it's been great. It's been great. I've helped a lot of families since I launched, and Yeah, I was trained in the CRAFT method, which stands for Community Reinforcement and Family Training. And I also was trained in the Break Free method by Brad Lamb, who's a nationally recognized interventionist and has a facility of his own down in over in California. And was mentored for 18 months, meaning that I launched my business, but I asked my mentor to stay on with me. I didn't have to mentor that long, but I wanted to because I really loved the way he worked, and I wanted to learn as much as possible, right? And give these families and these individuals their best shot at recovery. And yeah, and that's what I do.
That's awesome. So do you feel as if, I'm sure it's not a requirement, but do you feel as if, I would imagine that most interventionists have some sort of their own life experience, like maybe they are in recovery, or not. I don't know. I have no idea. You're actually the only interventionist that I know. So
I feel honored.
Yeah, here you go. So my question would be, do you think that your strength, being you were one of them,
Mm-hmm.
do you think it's a weakness for you, like when you get the call from the parents? Because in my experience, it's like, I know that like it doesn't work until we're ready, until the user is ready to like just give up.
Yeah.
So I don't know. I guess my question is, when you're walking into these situations, do you feel as if it's hopeless sometimes?
No, actually, I always go into every situation with a lot of hope, and I always tell the families that. And the reason, and I tell them this, the reason for that is because I've seen the worst of situations turn around. Situations where people thought it was impossible, families hired me as a last-ditch effort, like the check off, like, this is it, Joe, I'm hiring you, or we're hiring you to try and do this, and then after this, we don't know what else to do, we're done.
Yeah.
And but to answer, I want to address something you said, and that's that, not until we're ready, right? Well, the whole idea behind an intervention process is to help them get there sooner, right? To raise the bottom. We talk about, there's a lot of talk about you got to let them hit bottom, you got to
Raise the bottom. I like that.
But what's bottom? Bottom could mean the ultimate sacrifice. So why would we wait for that?
Yeah.
Right? So we want to raise that bottom, right? And how do we do that? We do that by changing how we do things as a family, right? This is how I explain it to them, right? Because if nothing changes around your loved one, why would they change, right? Why would they be motivated or influenced to change? They won't, because it's the same Groundhog Day every day for everybody, right? So when we start to do things differently, that starts to have an effect on our loved one, and you start to send a new message and communicate with that person differently. What do I mean by that? A lot of what we talk about is boundaries and consequences. Boundaries and consequences are in no way, shape, or form supposed to be a punishment. I think, old school thinking was like, oh, well, you gotta
Throw
kick
them
them
out
out of the house, you gotta do this, you gotta do that. Look, sometimes that may
Throw them out.
That may have to happen, right? But prior to that, why don't we change other things, right?
Sure.
I'll give you an example. I'll tell a wife, you don't have to engage in certain conversations anymore with him. Conversations that are not going to go anywhere. They're just going to produce the same thing. They're going to escalate, and it creates nothing but bad feelings and a fight, and it's exhausting. So why don't you try communicating this way, right? He likes to drive you around drunk, and you've been letting him do that, so you say to him, if we want to go to the movies, we want to go to dinner, whatever that is, I'm not getting in the car with you if I know you've been drinking, As a matter of fact, I don't think I want to partake in those situations anymore if I know you're drinking, I'd love to if you weren't. I love watching movies with you. I love going to dinner with you. But not if you're drinking. If you're doing that, then I'm not going to partake anymore.
Yeah, because the active alcoholic, the active drug user can get real comfortable.
Yeah.
And then I guess it's our job to make them uncomfortable.
Yeah, right.
And-
Because if not, right,
yeah.
we always say if nothing changes,
Yeah.
nothing changes. I'll give you another example. I'll tell parents. We'll use the car situation again, right? We'll have the 21, 22-year-old who's not thriving. He's stuck in his room all day long, playing video games, smoking weed, and maybe doing other things, right? Not functioning. But when he needs stuff, or maybe he needs to go get, a handle of liquor or something, he takes their car, which is insured in their name, right? So I tell them, why do you let him do that? Right? Don't let him do that anymore. That's your car. You pay for it. And it's insured under your name. God forbid something happens, right? And let's help him understand that that's no longer acceptable and it's not going to happen anymore. You know, these are changes that you start to make as a family, right? To again start to influence that person. Start sending them a new message like, we're changing how we do things, and we need you to change how you do things. You know, and then I train them to do that for a little period of time, and then they start doing that right off the bat, right off the rip, and then I also prepare them for the intervention by providing them with letter templates. We use letters so that we can stay on point and truly say what we need to say on the day of the intervention. And then we execute, you know, and during that time also I have treatment set up already. You know, like we've made plans, like, okay, once that person
Sure.
says yes, where are we sending them? What's the best fit? What's the most appropriate place for them?
Prepared. So when dealing with an active alcoholic or an active drug user, if it's somebody that you care about and you want to help them, the reward is absolutely tremendous, and the risk is equally as great. It's about living or dying, right?
Mm-hmm.
So to do nothing it's not the right answer. You know, everyone's suffering. The active user suffering, you're suffering, family suffering. So yeah, that's why like guys like you are so important, you know, like to be able to take a very emotional situation is what it is and look at it through like an intellectual lens and remove the emotion from it, right? That's what you're doing. You're going in there and you're just like, you're starting the process. Because again, if you succeed or when you succeed, when the family succeeds, it's the rewards are you know, me, and everybody else who has recovered and isn't in pain anymore. So yeah, it's worth it.
The families I work with are always so grateful. You know, even if initially their loved one says no to the treatment, and that happens, right? Let's be real. Anyone out there doing interventions that says, "Oh, my method works 100% of the time," is not being truthful. Okay, that's just not the statistics. In what we
Clickbait.
do. Yeah, it's not the statistics or the real statistics in what we do. But I could tell you that the craft method, which is the method that I practice, you can look this up, is successful 7 out of 10 times, 70% of the time. That's a good number, you know, but that's a real number, right? 30% of the time they say no. But even in those situations, the families are so grateful by the time we're done working together because they're elevated. They're on new footing. They have a new understanding as to the disease, as to why their loved one is acting the way that they do. And they have new tools and new coping mechanisms, right? They have a way to relieve what they're going through. And then I always instruct, and I always stay in touch with them, like forever. I say, well, once I work with a family, they're my family forever. You know, I always tell them that. You can call me whenever you want,
Sure.
you know. And I've gotten calls where they've kept everything in place that I've taught them to do, right? The boundaries, the consequences, all that. And I'll get a call 3 months later. Guess who went to rehab this morning? You know?
Yeah.
And those calls really make my day. You know?
Yeah, so the idea of hiring an interventionist and then going through the process and looking at it as if it's a failure or a success, depending on whether or not they make it into rehab, isn't the case at all. Because what you're doing is you're actually starting the process, and like you said, the parents or families are feeling even if they don't go, they feel hopeful.
Yeah, I'm helping them.
They're hopeful. You've educated them. You feel this isn't a unique situation. Your son isn't this is very common. You know, like
Right.
this whole process. This is a common thing where the seed you're planting the seed.
Right.
You know, now we have to build off of it.
And I know you're tired, but this is something new.
Yeah.
You've never done this before.
You don't have a choice.
You know, let's hit the reset button and do things differently. And I always express to them, this is not just about your loved one's recovery. It's about your recovery too. The whole family needs to recover. You know, like I said before, it's called a family disease.
Sure.
And everyone needs to recover.
Okay, so I would imagine that the main goal for you is when you set up these interventions and you go to somebody's home for the first contact, your goal is to hit a home run, which is to get that person to agree to the fact that they have an issue with alcohol or drugs, and to get them to take their first step in whatever that looks like to get them to stop. So how do you go about deciding where you're going to place them, what their plan is going to be for treatment?
Mm-hmm. Yeah, so absolutely the goal is to hit that home run and get them to accept treatment, right? And if we can, as much as possible, whisk them off to treatment that very day, within the first couple hours.
Whisk.
Yeah. Well, because that window opens up, right? They say yes.
I'm agreeing 100%. Yeah.
You know how fast that window starts to close. But as far as what kind of treatment, so I get to know that individual through the family's eyes, right? We talk about the history, what's happened to this point, what's happening right now that you decided to take this step. What kind of substances is this person using? Are there any co-occurring issues, which most times there are, like depression, bipolar, ADD, trauma. Trauma is huge. There just always seems to be some form of trauma.
Mm-hmm.
So based on all that, and also person's age, right? What are their interests, right? Do they love outdoors? Do they love rustic? Do they like, for lack of a better word, bougie? But if the place is bougie but doesn't have good treatment, they're not going there. You know what I mean? Like, they're not going there. So we make a decision together as a family, and try to find what's the best fit, and it's going to give that person their best shot at recovery right from their first time being there. I come up with a plan A and a plan B, again, with their help, with their input. Plan A is always the optimal plan, right? If I feel a person really, or we feel that the person really should go inpatient for a period of time. But there's always a chance that they're going to be adamant, like, no, there's no way. I still have my business to run. I still have this. I still have that, right? Like all the excuses, right?
Yeah.
Although sometimes it's legit. You know what I mean? Like sometimes, maybe they're functioning.
1 out of every 20
really
is a valid excuse.
Yeah, well, right. But maybe they're really functioning, right, to a certain degree, but it's still causing all kinds of chaos. Maybe they can do an outpatient situation. I've seen people recover that way.
Sure, I agree.
So plan B is typically an outpatient situation, right? They say no way I'm going inpatient. Okay. We said at the beginning of our intervention that we wanted to, we don't call that an intervention in front of them, by the way. We said at the beginning of our conversation that we want to hear from you. We want to know what's going on with you, what you think, right? If plan A is no good, if you're absolutely not going to do that, what about this? And then we present plan B. And now we're empowering that person, right? They're actually having a true say in what's going on here.
Sure.
Right? And they feel better about it. And they'll hopefully say yes to B. But we always add the caveat at the end. But if this proves not to work, then you have to go inpatient, right? And of course they always say yeah. They always say yeah. But we try to get that commitment as well. So.
Have you ever been in a situation where, I don't know, it gets ugly? You're a big guy. So, like, you're a big guy, so I would imagine it works for you.
Yeah,
like,
yeah. Honestly, there have been situations where an individual has gotten aggressive. Not necessarily, though, directly at me.
Yeah.
Just in general. Yeah. Just yelling and maybe even, like, throwing things or, has anyone ever asked me to get... Yeah, one person has asked me to leave,
But politely?
Yeah. No, you need to get out of my house, Okay.
And
I'm like, well, the rest of your family doesn't seem to think that,
Yeah.
So a big part of my job, right?
Yeah.
Is to try and as immediately as I can help that person understand that, hey, I get you.
Yeah.
I understand where you're at. I'm a connector. I have to connect with those individuals as soon as I can so that, I can get them to kind of relax a little bit, lay down the defenses a little bit, realize that, okay, this guy, I may not like the fact that he's here, but he seems to know what I'm going through.
Sure. He kind of respects you.
So that's a big part of my job during the intervention.
Yeah, that's why I was asking you in the beginning. I was just like, hey, do you feel like your strength becomes your weakness and your weakness becomes your strength at times when you're dealing with them? Because, like, yeah, I'm going to go in there. I have this plan, even though I don't do this. But I'm saying, like, you have this plan and then you're asking all these questions and you're gauging him and you're just like, he ain't ready, you know, at all. And then because of your experience, you're like, you think it's a hopeless situation for that moment. But then the interventionist who's been trained kicks in, I would imagine, right?
Mm-hmm.
And then you go, so it's got to be a little bit of a...
You just keep chipping away.
Sure.
You know, you pivot where you need to pivot.
Yeah.
You know, and you look for the angles, and you also, you know, as professionally and as nicely as you can, you call them out on their BS.
It's a gift too, man. Like, you know, what you do, you know, like I'll talk to them for like 2 days and be like, you need to do this, you need to do that. And then one of my friends will just be like, hey man, look, you don't look good. We got to take you to rehab. And just like, and he's the way he is, you know what I mean? He's like, has this gift, and they're like, okay, you know, and it works, and he does it. I should put you in contact with him. Maybe you should hire him. But no, seriously, it's amazing what you're doing.
Blessed to be doing it, you know. I feel very blessed.
Sure, you're like on the front line there. You're right there. Like, again, I feel great as well when I talk to these guys when they're in rehab and they have like 4 days left before they get discharged, and I'm trying to sell them on recovery and feeling good about a bad situation that they're in right now. But you're really going in there. You need like a helmet.
Yeah. Well,
you should start walking in. You should be like, "Hey, how you doing?" But knock on the door with a helmet on, full gear.
Hold on, let me just put this on.
Yeah. That's so funny.
Yeah. I'm thankful for my training, my mentor, for my experiences. See, I don't consider it weakness, right? The big book says that we're uniquely qualified.
Sure.
To help another alcoholic. Why? Because we've walked in that person's shoes, literally.
Yeah.
We both understand the hell of addiction, what goes on in here, what goes on in here. So I feel very fortunate that I have these gifts, you know, that I can utilize in these situations and have an impact on people's lives. You know, it's hard. You know, you're right. It can be hard work. You know, you're in the industry, and even though we see a lot of bad things going on, tragedies even. Like I said before, I always go into these situations with a lot of hope, because there have been situations where I walked in, I'm like, this is going to be a tough one. It's going to be a tough one, you know.
Especially if you're going by what, like, you only know what you know. So you only know, like, the lady who's calling you or the guy whose father's calling you, he's telling you worst case scenarios, I would imagine, because that's how we are with our family. We go hard.
Well, yeah, because it's very emotional.
Yeah, but and then you're like, okay, then they see you and they're like, it's just, cut through.
Yeah. But I have a coworker or a peer of mine, and I love what she says. Joe, we're in the trenches, but we also have a front seat to miracles.
Sure.
To witnessing miracles, and I love that because I see it all the time. I'm sitting next to one.
Yeah.
The guy filming this, he's one of them. We all are.
Donnie. All right, man. It was a pleasure having you here.
Thank you so much, bro.
No doubt.